Hello and welcome to this webinar. My name is Angelina Andrews and I'm the Programme Manager for the Education, Learning and Development Programme at the Royal College of Nursing. We are delighted that so many of you have joined us for the introduction to RCN Learn and the RCNi Portfolio in association with RCN Learn. Just to also let you know that this webinar will be recorded for those who couldn't attend today. RCN Learn is an online space hosted on the RCN website, offering exclusive resources for all RCN members, along with a selection of resources for users with a free account and resources for subscribers to RCNi Plus. RCN Learn offers you easy access to learning and education that you need to fulfil your continuing professional development requirements and support the delivery of safe and effective care. It supports the entire nursing workforce across health and social care, bringing quality assured learning resources from both the RCN and the RCNi in one dedicated space. We'll be showing you what RCN looks like, RCN Learn looks like, how it works, and the different ways you can access RCN Learn. The RCNi portfolio, in association with RCN Learn, is one of our newest products, a revalidation tool for registered nurses, midwives, and nursing associates. You will be able to store, track and build revalidation evidence really quickly in one easy to manage online space. And later on in the year, we'll be launching a portfolio for members who do not need to revalidate, ensuring that all members have access to a portfolio. We will give you a demo of how the portfolio works and we'll talk you through those benefits today. In addition, we'll give you a quick overview of the CPD programmes which are available with academic credits if required and our suite of leadership programmes. You will also hear firsthand from two of our members on how RCN Learn has helped them so far. There will be an opportunity to ask questions, so please do click on the Q&A button and we will answer these questions during the Q&A session towards the end of this webinar. All questions that you provide us with will remain anonymous for the webinar. You will also see a link to the RCN Learn and a link to the benefits of joining the RCN in the Q&A if you're not a member already and wish to join. So I'm now going to hand over to Caroline Chalkley, who will introduce herself and talk you through RCN Learn. Thank you.
Thanks, Angelina. Good evening, everyone. I'm Caroline Chalkley and I'm the Project Manager for the Education, Learning and Development Programme at the Royal College of Nursing. And I'm really delighted to have this opportunity to show you around RCN Learn and highlight some of the key features and how you can get the most out of this fantastic site. So let's jump right in. You can easily access RCN Learn from the link in the navigation of the main RCN website. Here is the link up here on the right and I click it and access RCN Learn. Now we're on the RCN Learn homepage. At the very top of the site, we have website links to the RCN and RCNi websites, so you can easily navigate to those. We also have a contact us link here so that you can reach out and get in touch with us, whether that's with feedback or suggestions about the site or further questions. We really always want to hear from you to understand how we can improve the experience. Here you can see that I'm logged in. It's with my RCN test account. And underneath here, you can see we have a link for the revalidation portfolio, which my colleague Helen will show you later on the call. We have a page dedicated to the benefits of RCN Learn, and you can see that this page highlights the offer for each of the different user types, so registered users, RCN members, RCNi Plus subscribers, and also for organisations. We also have a page which details our product offering to organisations, which my colleague Andrea will explain more about later on the call. Going further down the home page, you can see that the first main action here is the search bar. And beneath it, there's an opportunity to view all the courses and resources. So you could just go and have a browse of them, have a good look and see what's there. RCN Learn is available for anybody to go and browse, but according to your user type, you will have a different level of access to the actual resources themselves. We have registered user content, which is available to anyone who registers for a free RCN account. And this content includes things like our standards, frameworks and guidelines. Using RCN Learn as an RCN member, you can access all the content that registered users can access. But in addition to that, RCN members can also access hundreds of other clinical and non-clinical resources, learning resources on the site. Using RCN Learn as an RCNi Plus subscriber, you can access all the registered user content as well as the RCNi Plus subscriber content. What you'll see is that when you're logged in, these yellow boxes indicate exactly what kind of access you have. So as an RCN member, you see that I can access both the registered user content and also the RCN member content. If you're an RCN member and an RCNi Plus subscriber, then all three boxes would be yellow. Scrolling down the page a bit further, you can see that we have our featured content section, and this is controlled by our RCN Learn editorial team. The content in this area gets updated to highlight new resources that have just been released, but also to reflect resources that relate to maybe specific awareness days that happen throughout the year. Going further down, there is a video here which gives you an overview of RCN Learn, and I think is a great starting point for somebody who hasn't perhaps used this site before. It's only a minute and a half, and it's a really good watch. Then these are links to further RCN learning resources. Firstly, the RCN Library, which is the largest nursing library in Europe. And as an RCN member, you can access the whole collection. That's books, journals, databases, and it's all specifically related to nursing and healthcare. Then you have a link to the different learning events that the group puts on. And on the right-hand side here, there's a link to view the RCNi publication offering. Just to note also that if you're logging in as a member from Northern Ireland, in this area here, you'll find a link for a specific page for Northern Ireland learning that you can access. RCN Learn is designed to get you to the most relevant resources as quickly as possible. So let's have a look by starting to search for some resources. I can either choose to enter a keyword here directly on the home page, or to view all courses and resources, which will take me through to the search page. That's what I'm going to do now. So here I am on the RCN Learn search page. As you can see, I can enter a keyword into the search. And I also have other filters that I can use to be able to find the content that's most useful for me. I can filter by particular subject area. As you can see, there's quite a long, extensive list of subject areas there. And I can also choose which type of content I would like to access. So I can choose to perhaps only view content that is accessible for RCN members. The last filter is the learning type. I can choose whether I want to find a course or a resource. A resource tends to be a more general piece of learning content, whereas a course is a more structured piece of learning content, which takes you through the learning sort of a step at a time. So let's have a look for some resources. Suppose I'm looking for diabetes resources. I come to the subject filter, select diabetes, and what you can see is that all the resources that are returned on RCN Learn for that subject. So I'm going to take a look at this one here in particular. That looks good for me. Diabetes Essentials. So each piece of content has what we call a tile. It has its own image that's relevant for the content. It has a subject heading here so that I can see that this particular piece of content is about the diabetes subject area. It has a title to tell you what the resource is all about, and it also tells me here that the resource is available to everyone. So that means that any logged in user, whether that's somebody with a registered RCN account, an RCN member, or an RCNi Plus subscriber, can access this content. So if I click through now, we'll go through to the overview page. This gives you a bit more details about the piece of content. There's a summary at the top and then a section that tells you who the content is aimed at. So you can decide whether the resource is relevant for you. On the whole, resources are aimed at the whole of the nursing workforce and in all care settings. But there are some pieces of content which are specifically aimed at nurses and nursing associates or other particular groups. And we do have resources that are specific to particular care settings as well. Just below that, you can see that we've got a full list of learning outcomes that you would expect to achieve having used this piece of content. And in this instance, it covers everything from diagnosis, treatment, management, and much more. Scrolling down the page, the next thing you'll see is the resource lead. And that's in case you've got any queries or you just want to follow up and get in touch specifically about this particular resource. There's also a date on there, so you can see when the resource was last updated. And everything on RCN Learn has been quality assured before going on the site. And we have a rigorous QA process that means that all the resources on RCN Learn are automatically audited at least on an annual basis. So now I'm going to go up and we'll have an actual look at the resource itself. So I click here on the yellow View Resource button, and it's taken me through to the resource, and you can see that this is a wealth of information all relating to diabetes. I'm now going to go to the main search page here. And I want to draw your attention to one of my favourite features on the site, and that is this little star here. And this is where you can go to favourite a resource. So it could happen that you found a lot of resources that you'd like, but you just don't have the time. You're a bit pressed at the moment, and you want to be able to come back and read it later. So you can star and favourite this particular resource and come back and view it at a time that better suits you. Going up here, you can see I've got a My Favourites link. And when I go into that, these are all the resources that I've chosen to favourite, and this is the one we've just been looking at, the Diabetes Essentials. Now, let's go and have a look at a few more resources. Just clear those. So, as I said, on the whole, resources are aimed at the whole of the nursing workforce and in all care settings. However, there are some pieces of content that are really specifically aimed at particular care settings. For example, care homes. So I'm going to use the subject filter and select care homes from here. And I'm just going to scroll down and have a look at this one here, which is the care home journey. As you can see, this tile indicates to me that it's available to RCN members. Clicking through again, you can see that the format is standardised, it's familiar. So who's the resource for, what will the resource give me, the resource leads and the date when it was last updated. And I can use the yellow button again to go through and view the resource itself. And there I've got lots and lots of content and information about a resident's care home journey. So this includes real life scenarios and answers to clinical questions that I might have. Now, most of the content you'll find on RCN Learn is UK-wide. However, there are some scenarios where we need to have specific content for the different nations, and consent is one of them. So I've typed consent in as a keyword up here, and you can see these are the resources that have been brought back. And looking at the first couple, you can see that we have guidance that covers consent across all 4 nations. Let's take a look at the consent for Scotland. And once again, it will feel very familiar now to you, this format, the summary, who it's aimed at, the resources, and what it will give you. And clicking through again, you can see there's a wealth of information there about examples and scenarios for managing decisions relating to consent. So far, we've had a good look at content that is available for registered users and also for RCN members. What I'm going to do now is have a look at an RCNi subscriber piece of content. So let's take the example that I want to improve my communication skills. So I'm going to type that in to the keyword, and there you go. It's brought back some relevant results, and wow, that first one sounds exactly what I was looking for. So promoting effective communication skills in nursing practice, and it's telling me here that it's available to RCNi Plus subscribers. So for those of you who are RCNi Plus subscribers, you will be able to go in and access this course. So just the last point from me before I hand you back to Angelina, and that's just to mention that although I've been showing you RCN Learn site today from my laptop, the whole site and all the functionality works exactly the same way on a tablet or on a mobile device, so you can access it in any way that you want to. I hope that this has given you a good overview of RCN Learn and how you can make the most of this great resource. As was mentioned earlier, if you've got any questions or feedback, please do pop them in the Q&A and we'll try and get back to you. And I'm going to hand you back now to my colleague Angelina. Thank you.
So I'm now going to hand you over to Helen Sumner, and she's going to introduce herself and give you an overview and demonstration of RCNi Revalidation Portfolio in association with RCN Learn.
As mentioned, thank you, Angelina. I'm going to demonstrate the revalidation portfolio for you. Okay, so I've popped back into RCN Learn, which is where Caroline just was, just to show you how you can access the revalidation portfolio from RCN Learn. As you can see, there's two ways of doing it. There's a drop-down dashboard here, and if we click on dashboard, you can see that you can click into portfolio that way, or if you go back, you can also click into it straight from the nav bar. So that's what I'm going to do now. So this is a portfolio that I have already created. This is a test account, by the way, just in case everyone's concerned. This is all test data. So the first thing that will happen if you haven't previously logged in and created your portfolio is you'll be asked to create your portfolio, and you'll be asked for two pieces of information to do that. The first one will be your NMC registration date, and the second one will be your NMC registration number. Having the correct NMC registration date is particularly important because, as you can see, what it's showing in the header is this is a portfolio for the period of time during which you are revalidating and leading up to your revalidation date. So it's quite important you put your registration date in because then it will map it to the correct period of time. Otherwise, your progress bar won't look quite right. So moving on down the page, the way the tool has been set up, it's been designed specifically for people who register with NMC. So it's different to other revalidation tools that are out there, but this one is specifically NMC, mapped to NMC requirements. And as those NMC requirements change a little bit over the years, this portfolio is updated in line with that. It's been made very easy for you to see at a glance exactly where you are with your requirements using a red, amber, green coding. So as you can see, each individual box has its own red, amber, green coding, and then there's a progress bar at the top that shows you in total how complete you are in terms of your revalidation. In this one, I am 32% complete, but because I know I don't revalidate until 2025, I'm actually not too concerned about at this stage. If it was 2 weeks out from revalidation, I might be quite a lot more concerned. So moving down, those of you who have revalidated already or are familiar with revalidation will know that two of the key requirements are around CPD. So there's a requirement for 20 hours of participatory CPD and up to 15 or more hours of individual learning. So these two boxes are where you would log your CPD. I'll just show you how to add CPD, and then I'll show you how you can view what you've already done. So all of these boxes are designed to be as intuitive as possible. They are all work in the same way. So when I demonstrate this view, it will be the same for all of the other boxes. So I now want to log my individual CPD, so I'm going to click on Add. And what will come up then is a pop-up box. And in this pop-up box, I'm going to have the title of my CPD. I did it today, so I'm not going to change the date. I can, all these other fields down here are optional. I don't have to fill them in if I don't want to, but if I want to, I can say I've attended a course. And then I can also select what type of course it was, what type of activity, you know, maybe let's have a look. Maybe I did some peer review activities as part of the course. Moving down, I can put the topics in, and this is all really for myself, or if I want to discuss it with my appraiser, I'll just put in notes about what I learned and how it's linked to my scope of practice. It's essentially whatever information you would find useful for yourself in there. Again, moving down, again, this is optional, but if you want to, you can tick which part of the code it's relevant for, the learning is relevant for. And you can also fit it into a midwife, a nurse, or a nursing associate who is filling in this form. I've put it on the nurse. If I want to, I can now link it to my NMC standards. Or if I'm a midwife, I could link it to my midwifery standards, or I could link it to nursing associate standards. Just use this down real quick. And there's a link through to the nursing standards of proficiency if anyone just needed to put that in. And here I can put in the number of hours. So I'm going to say I've done 1 hour and a half. If I want to, if I have a document, if I've taken a photo of something, or if I've got an online document, I can upload it and store that in my portfolio if I want to, and I'll show you where that would store in a minute. But on this occasion, I don't want to. I'm just going to save it. And then what you can see is this then changes my progress bar. I'm still right up here, unfortunately, but I'm now 70% complete for my individual CPD. What I can do as well, if I want to, is view what I've already done. So I click on view, move down, and then I can see all the CPD I've already entered. And if I want to, I can edit that and go back in and change whatever I want, or I can delete it. And it will remove it from my portfolio. And then if I go back, dashboard, that one changed. So I'm back down to 61 hours in my CPD. So it works instantly. So all the other boxes work in exactly the same way. You can add and do your practice hours, and all the other requirements of the NMC are on here. So, and it will tell you. So you need to do 5 reflective accounts. I've done 1, so it's telling me that I've done 1 of my 5. I have actually had my reflective discussion, and I've done that. So it's telling me that's exactly complete. I've done 1 of them. It asks my practice-related feedback, my health and character, my professional indemnity, and information. If I just come back up here to this box, you can see in this box here, if I'm logged in as an RCN member, if I was a subscriber, if I was an RCNi Plus subscriber, I would be able to click on this box, and clicking on this box would take me through to a range of test my knowledge quizzes that are available as an RCNi Plus subscriber. RCNi Plus subscribers are people who've subscribed to RCNi Plus on top of their membership. The cost for members, it's a discounted cost for members, which is £10.50 a month. If I was a member, I would be able to click on these quizzes. They're very quick, 10 quick questions. Benchmark your knowledge. If you're really happy with it, you can add it to your portfolio, and then that goes into your CPD requirement. If you think, actually, I need to refresh a bit on this particular topic, there is a CPD article linked to each of those quizzes. You can click on that CPD article, refresh your knowledge, and then do the test again. And then if you're happy at that stage, you can upload. Obviously, as you know, you are not being tested for proficiency. This is just for your own learning. But it's entirely up to you about how you wish to use that and add it to your portfolio if you have got a subscription to it as well. So moving down, if you have got certificates, this is where you can store them. So if you've attended a course and given you a certificate or at the end of an online course, those can all be uploaded as a gift to keep for you. And any other supporting documents that you feel are relevant for either your own learning or for validation can be put into this supporting document box as well. And then at the end, if you want to, you can download your entire portfolio. So you may wish to do that if you want to have a chat with your line manager or your appraiser. Simply click the download button. It generates the download, and it's there documented for you what you've done and the number of hours that you have done. You can then download that to your own desktop, or you can print it out directly from here. Just moving quickly to the top of the page. This is a test account, so it's not lined up quite correctly, but across the top, you can see that it says NMC forms. Quickly, what that will do, that will take you to a page where, as you can see here, it's taking you to nmc.org.uk. You can click straight to forms and templates if you wanted to access those. Going back into here, there's also, it's slightly hidden in, there's something called guide, which is a complete guide on basically everything that I've been through with you just now on how to use your RCNi Revalidation Portfolio. It has been designed to be as intuitive as possible, but if you did have any questions, it's all there available in that guide. Excuse me. Then quickly moving down to the bottom of the page. There's some FAQs here, which I think Angelina mentioned in her introduction, that are available for RCN Learn and for RCNi Revalidation. So if you've had any questions, again, you can click on here and go through to frequently asked questions. If you haven't got the information you needed through the FAQs, there is a contact customer service link here as well. And this is the contact customer service that will take you to the portfolio customer service. So if you've got any questions about portfolio, this is where you to get an answer to your query. So I think that's it from me. Thank you very much. I hope that has been clear about how RCNi portfolio could benefit you. But again, if there's any questions, please put them in the Q&A and we will get back to you. And I will come back to Angelina. Thank you very much.
Oh, thank you, Helen. That was great. So I'd now like to introduce our next speaker, who is Andrea Child, and she's going to introduce herself and take you through the CPD programmes with academic credits if required, and also the leadership programmes.
Thanks, Angelina. Hi, I'm Andrea Child. I'm a professional lead for education here at the Royal College of Nursing, and I'm also a registrant. So a big hello to my nursing team on here, and it's really, really good to have you on board tonight. I'd like to walk you through some of the programmes with academic credits, and then if I have time, I'd like to touch on some of the leadership programmes. Okay, everyone, so if we go to the top right-hand corner, you'll see a tab here called Organisational Products in the corner. All of the products I'm going to show you now will also come up on the general search site that Caroline was demonstrating, but they're all in one place, so let's have a look at them. We'll just scooch past the leadership programmes for now. I will come back to those. We have a suite of 3 programmes on the screen, and these are available to every role across all types of nursing environments, so NHS, third sector, the independent sector, and any role and any grade or level can apply, so there's no restrictions. All of our programmes at the moment are virtual. They're all 6 half days, and they've all got 6 separate hourly coaching sessions included. So the 6 half days plus the 6 coaching sessions. So I'd like to walk us through first our newest product, and it's the RCN Leading Sustainability in Health and Social Care programme. Gives you a very quick snapshot, but I'm going to open the tile. And as Caroline demonstrated, they've all got the familiarity, so when you're walking through them, you'll understand where to reach your information from. Straight away, we can see the cost. I think that's most important in the headline. It's over 4 months, the next dates, and you can apply to study at level 6 or 7 to gain 20 credits aligned to Coventry University. And as said, they're all fully online at the moment, and each site will give you context to the programme and a wee film clip. And importantly, on the right here, you'll see to register your interest. That doesn't commit you to the programme. Someone from that programme will come back and answer any questions that you might have. We'll continue down the page and we have a concertina of different questions. We could talk about the programme, what kind of things might you be learning, the programme aim, any programme requirements. On this particular module, you will study through a 3,000 word essay, and as you can see there, that's for 100% of the marks to apply for the credit for 20 level 6 or 7 credits with Coventry. And further information on the dates and the costs. You'll also see some lived experiences, some past participants and how they've used the course to enhance their nursing role. And also some frequently asked questions. I'll take us back to our main page, and then I'll walk through one of our largest products. It's the Infection Prevention and Control programme, The format again is the same. Instantly you'll see the cost, the duration, the levels and the credits, the current context. I wanted to show you things are slightly different on this programme. So it's still the 6 half days, still the 6 coaching sessions, but you will study towards your 20 credits by completing a service improvement project. Same amount of words, but a different approach. And again, you can contact the team if you have any questions at the bottom here. Our third credit module is the Leadership to Improve Physical and Mental Health module. The same format, the same context, and here you will also study towards a service improvement project towards the 20 credits at Coventry. Excuse me. I'll take us back now to the leadership courses. All of our leadership programmes have something for every role across the nursing workforce, and again, from any working environment, irrelevant of where you're working or what role you're in, you can apply to come on one of the courses. Now, some of the courses are commissioned only, and the first one is a commission only programme. So if you see something here tonight and you want to take it back to your employer, the information when I open the page will give your employer the information to commission a whole cohort. This programme is for levels and bands 2 to 4, so those non-registered colleagues. It's over 3 months, it's 3 workshops, and it has coaching opportunities. The next programme is our Developing Leadership programme. This is commissionable, but also the RCN run this twice a year independently, so you can apply for your own place or your employer can apply for a single place for you. This is for band level 5 with some rising 6. It's where you think you sit in the programmes. We have the context, we have a wee film clip, and as you can see, this programme is underpinned by the Nursing and Midwifery Code. We've built it around the code. You'll see the topics on the right in this purple box absolutely align with the professional practice identified within the code. These are 2 separate study days with about a week or 2 apart to encourage reflection, and will also encourage you to think about an aspect of change you might consider once you've completed the programme. And the costs here are for a single person or they are for the full cohort. And again, you can contact the team down below there. Our third leadership programme is the Clinical Leadership Programme, and this is for our band levels 6 and 7. This is only via commission, and you will study over a year. There are 6 modules. There are 6 coaching sessions, and you will work to a more detailed service improvement plan that aligns with your employer's aims and objectives. This is for cohorts only, but you'll see if you want to take this back to your employer, there's lots of past participants talking about how they've used the knowledge being on the course and how they've taken that into practice. And the last programme I want to show you is the Demonstrating Value Masterclass. I know that from my experience being a nurse, I was never taught about finance, writing business cases and trying to get from A to B and developing my argument to get from A to B. So this Demonstrating Value Masterclass gives you those skills. It helps you build those skills to take your project forward. It's 1 day, it's online, and you can see the cost there on the top left. And again, this is for any role, any working environment. And if you want to register your interest, you can do so there. And we have some next dates coming up. Also, some past participants. I think that brings real meaning to any programme when you can hear how people have applied it to practice. I'm going to pause there and I'm going to hand back to Angelina.
Thank you, Andrea. I'd now like to introduce 2 of our guests who are RCN members and learning reps for RCN, and it's Shika and Dunni, and they're now going to share their experiences of RCN Learn so far. So please feel free to introduce yourself, let everybody know on the webinar your roles, and then I'll pose 3 questions to allow everyone to hear about your experiences of RCN Learn.
All right. Hi, my name is Shika. I work as a practice development nurse in one of the hospitals in Harlow. So, yeah, I think that's it. Do you want to ask the questions, Angelina?
Yes, of course, I can do that now. That would probably be easier. So could you tell us a little bit about how you have used RCN Learn in your practice / specialism? What do you perceive as the main benefits of RCN Learn? And finally, would you recommend RCN Learn to your nursing colleagues?
Absolutely. I think the biggest standout point for me for the RCN Learn is that it's quite robust, and basically it is giving you that unique approach where you can get all your education and all together in one place, and that will definitely support the career development of the entire, I would say, the nursing workforce. Another very key point in here is that it's open to everyone, so it's not only limited to the nurses, it's open to the student, the healthcare support workers. And in my role as a practice development nurse, what I have started doing already is making people aware about the portfolio thing which is there, so that they can start knowing about the revalidation from day 1 when they join the trust, join the union, because I think and I'm a strong advocate for international nurses. I think that is a very big thing they might not be aware about when they join, when they come to UK. So I think because in the portfolio section there is everything which is all together. So I have the forms which I can show them around, and they will have all that added on that portfolio is really, really great. And also I think for me personally, I'm doing my master's and I was looking for some researchers and resources. I think I got some of those resources available in RCN Learn straight away. So I looked into the search button and put what I was needed for, and I just got it very straightforwardly. So I think that's again a very good benefit for all the members. And I think it is quite evidence-based as well. So that's also very important that it is updated and is evidence-based. So that's really, really good as well. I think that's it from me. Thank you.
Now I'd like to introduce Dunni, and if you could introduce yourself and answer the questions and give everyone an overview of your experience of RCN Learn, that'd be fantastic.
Yes, thank you, Angelina. Hello, everyone. My name is Dunni Akimbulumo. So I work as the pastoral care nurse supporting overseas nurses in East Lancashire hospitals, and I'm also the learning rep for the RCN in my trust. So the RCN Learn, it's a very wonderful resource. I've used it myself many times. And then in my role as well, supporting overseas nurses, I've used it as well because I've had to draw from courses and things, materials on the website as well to create learning resources for the nurses as well. And that's really key, because when nurses come into the country from overseas, they need that that resource to help them get integrated into the workforce as well. So I've used it, and I've also learned to refer nurses there as well. And like Shika was saying, the revalidation portfolio, it's very, very lovely, and which is what some of the nurses do struggle with as well. So I've used that myself as well. And the communication bit as well, I've learned. And one of my favorite one is the 4 steps, so which is meant for healthcare assistants, but our nurses have found it helpful as well, especially nurses coming from overseas. They found it very helpful. Just gives them a very concise and robust introduction into the learning, and yeah, it's been very, very helpful. I've used it myself as well. Thank you.
That's great. Thank you so much. I'd like to thank both Shirka and Dunni for giving up their time today, and a huge thank you to both of you for that time. So we're now going to move across to the Q&A session. I'm going to hand over to Julia Fawkes, who's now going to read out some of the questions, and there'll be various people within who've been speaking today that will be able to answer them. If there are any questions that we aren't able to get through during this webinar, we will respond afterwards. So over to you now, Julia.
Okay. Hi, yeah, thank you for all the questions. We're going to start off with one that we've had a few people ask this question about, whether there are any free CPD courses for RCN members. So I think Helen is going to answer that one first.
I am. Thank you, Julia. Yes, there are. So what you'll notice from the talk that Caroline gave us on RCN Learn is there's 3 ways to access RCN Learn. The free one is the registered user, so you do not need to be a member or a subscriber to register. So what you do is when you go onto RCN Learn, you click on sign up, and if you're not a member or a subscriber, you can still sign up. You'll be asked for your email address, and having provided your email address, you will then have access to the free courses. The one that Dunni mentioned just now, First Steps, is actually a free course. It's a really well used free course, and it's very comprehensive, and that one's very popular. Also, we've talked about RCNi Plus on RCNi website, so on the website rcni.com, which is part of the wider RCN, but it is a premium product to the RCN product. There actually are also some free courses. So there's some free webinars, which you'll see on the website, on the RCNi website, and there are careers fairs. And at the careers fairs, as Andrea knows, because she attends them very regularly, there are CPD sessions, which do give certificates at the end of those sessions and do count as CPD. What we're going to do as a result of this, it's been really useful, is we're going to make sure that the links to those free webinars and free careers fairs are added to that box that Caroline showed us of the RCN and RCNi events, and make sure that they're very easy to find there. But ahead of that, if you just register, you will be able to get some free content. I hope that answers that sufficiently.
Thank you, that's great. And sort of relating to that question as well, just a bit more about sort of the difference between it being an RCNi Plus subscriber and a member, and whether you have to pay extra for the CPD courses would be great as well.
Thanks, Julia. Yes, it is a little bit confusing, I think, isn't it? So when you become an RCN member, there is a whole range of content, again, as Caroline showed us, already there on RCN Learn that is free to you as a member. So there's this, I don't know how many, 200 or 300 courses there as an RCN member that are free for you. If you wish to benefit from thousands of articles and learning modules, that is a premium product, which is called RCNi Plus. And for members, it's a discounted offer. It's £10.50 a month. And that gives you access to all the RCNi journals, including Nursing Standard, Nursing Other People, learning disability practice, nurse researcher. I think there's 10 journals that will give you access to, and it will also give you access to 200 or 300 learning modules. So that is over and above what you get as a member, and you do pay an additional rate for that, and that enables you to access all those thousands of additional pieces of content.
Thank you. Right, we're getting lots of questions through now. How does RCN Learn differ to or link with the ELFH learning website? Not sure. Is anyone familiar?
No, sorry, not at all.
Julia, we can come back on that one. We
come
can
back on
answer
that one.
that one after the webinar.
Perfect. The CPD course with academic credits, is there a minimum degree level required for that?
I can
Andrea?
take that one, thank you. No, I checked with the leadership team colleagues. There is no pre-requirement. If you feel you can and wish to study at that level, absolutely you're welcome to apply. Great question, thank you.
Another person saying RCN Learn is very good, but what is the advantage over using the NMC revalidation site? The latter is what she currently uses.
Is that for revalidation?
Yes,
I'm guessing
presumably.
From that the value really is, I mean, it's personal preference. So if you're happy using the NMC site, you know, by all means continue to use that. The revalidation tool is something that's been a benefit that's been provided free for members as a benefit for those members who wish to use it. I think the benefit of it is it's very quick and easy to use, and you've got the red, amber, green that gives you at a glance where your progress is, but it's personal preference, and if you prefer to use the NMC one, then there's no difference really.
Another question, is it possible for organisations to share their courses through RCN Learn for information purposes, for example, cancer care modules, to help direct professionals to further learning opportunities that are available? So we currently, did you hear that?
I didn't quite understand it actually, Julia.
So
sorry.
I think in terms of sharing external courses through RCN Learn, so that sort of relates a bit to our accreditation. We do that. Currently, we're not doing that on RCN Learn. It is mainly, RCN courses and programs that are run by the RCN, but that's not to say that possibly won't happen in the future. I'm the content editor for RCN Learn as well, just to introduce myself. So I work on the content on the site. So another question here. Someone's a bit unfamiliar with the CPD units. It shows that they need to put how many CPD units for the training or course that they had, but how do they know how many units are required? Is the units equivalent to the hours spent for that course?
Yes, I could just jump in quickly on that. Yes, it's hours. It's not measured in units, it's measured in hours. So just put in the time that you've spent.
Okay, we've had lots of this question, so I definitely want to cover this before we finish at 7. So this webinar today, whether it counts towards your CPD or you receive a certificate, someone saying, do we get certificates for the webinar rather than just writing a reflective piece? So Andrea, I don't know if you want to cover that.
Thank you, absolutely. And the NMC revalidation pages tells you to be creative. It does say, you know, it is countable if you're with more than 1 or 2 people, that you're discussing nursing, you're discussing learning. So I really can only encourage you. It's not a specific piece of learning, but you are in participatory learning. So you're learning and you're hearing together and you're hearing other people speak. You're looking at those questions, you're receiving those answers, and you're trying to widen your access to learning. So that's where the reflective piece comes in on that question, rather than the certification that we confirm you've learned. You're learning yourself. Thank you.
Thank you, Andrea. So there's some concerns around the prices of the courses, sort of why it's different from applying to universities and whether it should be included in the membership. So if we could just talk a bit about the decision over the prices and how that compares. Not sure who would take that one.
I think that might be one to come back to.
Yeah, we can come back and respond to that one.
Okay. Is there a minimum term to sign up for RCNi Plus?
There's a monthly direct debit, so I probably shouldn't say this, but you can sign up for a month.
Does the RCNi offer access to any non-medical prescribing journals?
They're all nursing journals.
I think we're covering, as bank staff, I do mandatory training with a clinic and I can download the certificates. Are these mandatory training considered as CPD or not?
Thank you. If I've put some links, I'll put some links in the chat for that question at the end, both from the NMC revalidation support and from the NMC. It gives a clear list of what you can and can't use. So I hope you find that helpful, and I will put those in afterwards.
Great, and some information, any funding for courses as well? That one for afterwards.
Can I take that one, please?
Yeah.
There's lots of routes for funding, and again, I'll ask Julia to put the link in the chat. Do consider applying for the RCN Foundation Learning Grants. There are so many bespoke grants, and I'll give you an example. We have the Association of Needle Makers, who award education grants to anybody that uses a needle in their profession. So do have a look on RCNF education grants. You don't have to be a member. It's for anybody in the health and social care workforce, and I'll make sure that link comes in. Thank you.
I think one last question that we haven't asked is, which date should I put for the NMC registration date, last revalidation date, or the due date for the next revalidation?
I'll take that. It's up to you, really. The portfolio will be created from the date you put in. So if you're very close to your next revalidation period, a couple of weeks away, you might want to put in your next revalidation period so you can start your whole 3 years from new. If you've got a long way to go before the end of your revalidation, you'll probably want to put in your last revalidation date. So it really is up to you and depends on where you are in that cycle.
Thank you. And just back to Andrea, are the grants available for international nurses, do you know?
Great question. Is that international nurses working in England? Then yes, absolutely. In the UK, sorry, absolutely. Anybody who is working in health and social care, any working environment can apply. Some of them are bespoke because that money's been bequeathed, say, from a family or in the name of a person, but generally there's a lot of broad education grants. Please do have a look. There's many on there.
Okay. Someone pays the monthly fee for the RCN. Do they have to pay extra for RCNi Plus?
Yeah, yes, they do. RCNi Plus is the premium product. It's over and above membership.
Does the portfolio, the online portfolio, show how to upload evidence?
It does. I didn't click on that, but if you go back into the guides where I showed you the guide, that will take you through it step by step. But essentially, there is where I showed you the document box or the certificate box, depending on what kind of evidence you want to upload. There is an upload button, so you can use that button, or if you're unsure, just follow the instructions in the guide.
Okay, I think that's all we're going to cover for tonight with sort of 4 minutes left, but thank you everyone for the questions.
Great, thank you. That was a great question and answer session. So thank you for everyone for posting those questions and to everyone who did answer them. And as Julia said, if you have got any further questions, you can contact us and contact the team. When you go into RCN Learn, if you go to the top right hand corner, there is a contact us button, so just click through on that, and then we will respond to you, you know, within a few days with regard to that response. So we'd like to thank you very much for your attendance today. We appreciate that time is important to everybody, and we've had a lot of attendees, and I hope you've really enjoyed this session. So thank you for your time.